Welcome back to the New York State Department of Health Clinical Education Initiative Building Blocks for Trans and Gender Diverse Care series. My name is Kai. My pronouns are he and him, and I'm a clinical educator with CEI.
And I'm Erica Bostic. My pronouns are she and her, and I'm an adolescent medicine physician and faculty for the CEI Sexual Health Center of Excellence.
Okay, so far we've covered gender-inclusive language, the do's and don'ts of talking about and with LGBTQIA+ people, and the good and bad of living in today's world as a gender-diverse and/or trans person. Now we're going to start getting into how you, as a healthcare professional, can offer affirming healthcare for trans and gender-diverse people.
We're going to start where your patients do, at the front door.
As you've probably already noticed, your patients get a lot of messages from your clinic's walls, pamphlets, advertisements, forms, nurses, receptionists, and other staff before they ever see a provider. It's important to know what these messages are and to make sure that they're actually in line with what you are hoping that they're saying. One way for you to find out is to do an environmental scan.
Performing an environmental scan means taking a critical look at your clinic's location, paying attention to aspects of the environment that you might otherwise ignore.
It's helpful to have a guide or checklist when you're performing an environmental scan to keep you on task and to ensure that you don't skip over anything important. We'll use this one that I made as an example. So to start, let's take a look at the outside of your clinic and the surrounding area. You may have less control over the outside of your clinic and the surrounding areas compared to other portions of the audit that we'll go through. But the entrance to your clinic will nonetheless set the tone for your patients. Even if you identify opportunities for growth that are out of your control, recognizing the tone that your clinic's facade and surrounding areas is setting can help you meet your patients where they are once they get inside. Growth edges identified here can also uncover some reasons why patients might not be seeking care at your clinic, despite the benefits that you believe you offer. So to start, let's look at accessibility. Is the health center easy to find? Is it accessible through multiple modes of transportation? Second, we look at security. Is the health center in a well-lit, safe location? Is there a security and/or police presence? If yes, are security personnel trained to work with LGBTQIA and racially diverse people? Lastly, signage. Are there signs that indicate that people of all genders will be welcomed? Are there any messages that might actually be exclusionary? Now, let's go inside the building. And once we're there, we're going to focus our attention first on the messages that patients are receiving from the walls of the clinic. Look around. Take note of the role that the following characteristics and elements might be playing. First, look for signs. What signs are present on the walls? What messages are they conveying? If your gender identity differed from your sex assigned at birth, would the signs represent you, or would they present you with unclear instructions? Next, look for images. What images are displayed on the walls? On posters, hanging materials, etc. If there are people pictured, are they gender diverse? Are LGBTQ and poly relationships represented? Is there a diversity of skin colors and religious and/or modest clothing? Are disabled bodies displayed in stereotypical or normalizing ways? Number 3, look for symbols. Are there symbols of inclusion and pride on display, such as the pride flag, safe space stickers, or other anti-hate messages? Fourth, look for an anti-discrimination policy. Is there an anti-discrimination policy for your clinic? And if so, is it displayed? If so, are there actual protections for gender identity included? These are important things to check because your gender diverse patients will be looking for them. Lastly, take a look for the colors in the environment. What colors have been used to decorate the walls? And what messages are these colors conveying? Are different colors used in different parts of the clinic, like a pink and purple wall in the, quote, women's health section? This is something to be aware of. Now that we've looked at the walls, let's pay attention to the sights and sounds in the clinic. Specifically, look for visual messages that your eye takes notice of. Look for flyers, handouts, books, bathroom signs, languages used in informational pamphlets, the magazines, brochures, any TV or computer screens, and event flyers around. What kind of seating options are available? Are they good for everybody? Then maybe close your eyes and take notice of the sounds in your environment. Listen for music. What artists are represented? What styles? Are there informational messages available auditorially? How are patients being called back when it's time for them to see the provider? By their first name, last name, some other indicator? Are there any alarms going off? Are patients talking? Overall, what's the stimulation level in the environment? Next, let's look specifically at the forms that your clinic asks patients to fill out. Start with a general sense. Does this form provide me with an opportunity to tell my provider who I am and how I would like to receive care? When I fill out this form, do I feel like the information requested is relevant to my care? Or is it clearly just a bunch of boxes that need to be checked for the system? Look for a place to put your name. Does it specifically ask for my affirmed name and my legal name? Is there an explanation as to why my legal name is needed? Is there any place to put my pronouns? Am I offered a sticker or a pin in order to display my pronouns while I'm in the office? On this form, is there an organ inventory or anatomy survey? Does it offer me an opportunity to indicate the organs that I currently have? Are my body parts assumed based upon my sex assigned at birth, or are your forms indicating that there might be variation? And are there any sections that are gender specific, meaning that they are labeled women only or men only? Now let's walk beyond our waiting room and go into the exam rooms. It's now time to see what messages are being shared within and by the exam rooms themselves. While some aspects of the exam rooms must comply with certain standards and meet certain needs, there may be some ways in which exam rooms can be more comfortable for trans and non-binary folks. First, look for preventive health information. Are there signs or messages related to preventive health in the exam rooms? If so, are they inclusive of trans and non-binary bodies? Second, look for affirming messages. Waiting for a provider in an exam room can be a really tense time for any patient, but particularly trans and gender nonconforming patients who have been marginalized by the medical system. So are there affirming messages to be found in the exam rooms? Are there opportunities to add affirming messages, such as all are welcome here, tell us your pronouns, or pride flags? Third, are the rooms gendered by definition? Are exam rooms decorated differently depending on the procedures performed within them? For example, are rooms with footrests decorated with stereotypically feminine accents or drawings? The last step of the audit is to take a look at your policies and procedures. This is really important because you need to at least recognize the ways in which certain policies and procedures may alienate or marginalize the transgender and gender non-binary community, and ways that these policies and procedures may be improved. More than anything else, it is absolutely critical that policies and procedures are clear to patients before they enrolled in care. Failure to make policies transparent will lead to confusion and mistrust. One aspect of policies and procedures to think about is confidentiality. It's critically important that trans and non-binary people understand who will see their health information, including some seemingly basic information such as legal name, affirmed name, pronouns, and history of gender transition. This can be particularly salient when a patient is underage and a parent might be able to see a billing statement. Next, take a look at the scope of practice described in your policies and procedures. You need to decide what services you are willing to provide at your office and which you will refer out to specialists for. Once decided, it's imperative that you use warm handoffs to ensure that your patients are getting great care when they go and seek another provider when you have decided that you need to refer out for that service. Also, it's really important that you take a look at how you handle consent for transition-related care. Are you going to use an informed consent model, or are you going to require that letters be written by other healthcare professionals before you get started? This is a complicated topic and it deserves some thought. So make sure you put some time and effort and discussions into it before you start offering any hormonal care.
And that wraps up the audit, so stay tuned for our next video.